Steamboat Orthopaedic and Spine Institute offers care with fellowship-trained physicians in the area of sports medicine, orthopedic surgery, shoulder and elbow surgery, foot and ankle surgery, spine surgery, hand and elbow surgery, total joint replacement, and shoulder arthroscopy. Dr. Alex Meininger is a board-certified orthopedic surgeon with fellowship training in orthopedic sports medicine and tells us about bear surgery, which is a revolutionary option for patients to restore their ACL tear instead of undergoing more invasive reconstructive surgery.
I'm the managing partner for Steamboat Orthopaedic and Spine Institute here in Steamboat Springs, Colorado. We're a single specialty orthopedic group with a multitude of partners that do spine, hand, foot, shoulder, and myself, I practice orthopedic sports medicine. The knee is naturally held together with 4 ligaments. Ligaments are the structures that attach 2 bones together. They allow the knee to operate like a hinge. The ACL is the most predominant one because it provides both rotation, stability to the knee, and when torn, it can cause the knee to be grossly unstable, meaning it gives way, wobbles, causes people to fall. So the injury can be quite dramatic. When the ACL tears, it's surrounded in synovial fluid and enzymes that prevent it from naturally healing back together. So the standard of care, the treatment for the last 30 or 40 years has been to replace the torn ligament with what's called a graft. That's the term for placing tissue in a new location. It might be tendon from your own body, it might be tendon donated from the bone bank or cadaver graft. And that graft is then installed within the knee through minimally invasive incisions and arthroscopic surgery. The graft is bolted in place and used to hold the femur and tibia back together and replicates the natural position of the ACL. What's exciting now, or since 2021, is that there's an alternative to ACL reconstruction. So the bridge enhanced ACL restoration, or the BEAR procedure, is a new operation to restore or heal or regrow your ACL once it's torn. Where a graft may require invasive measures to take tissue from elsewhere in your body or a means to avoid taking cadaver or donated tissue, the BEAR implant lets you keep your natural ACL. The BEAR implant itself is type 1 collagen. It's protein that's made in the laboratory, replicated into a cylinder. The cylinder looks like a generic packing peanut of styrofoam. But that protein is a sponge or a bridge, like in the abbreviation, the bridge enhanced ACL. Sutures are applied to the ligament. Sutures are put through the bridge to allow a conduit, literally a bridge between the stump of tissue and the bone where it's supposed to attach. The bridge is naturally hydrated or filled with blood and growth factors, and the bridge acts like a sponge to keep those growth factors in place. As we're not harvesting any natural tissue, it's less invasive, we're not requiring any extra incisions, and you're able to heal your own ligament back in place. The operation is more streamlined, requires less surgical time. Patients ensue less muscle atrophy, or they lose less muscle mass, less bleeding or perhaps less swelling in the knee, and an earlier recovery. In December of 2021, we at the Steamboat Orthopaedic and Spine Institute were the first to implement the BEAR implant in Colorado and the Rocky Mountain West, and we've had a robust collection of patients since then. It's generated a lot of patient interest in those that want to forego a graft or pursue ACL surgery and naturally heal their ligament. We also have some of the longest follow-up in that way as early adopters, and so I can safely say, both by physical exam, patient reports, return to sport, we have Division II collegiate tennis players, competitive downhill skiers, football athletes, etc., and everyday persons who are just maybe weekend warriors that have successfully healed their ACL with the BEAR implant.
Dr. Alex Meininger and the team at Steamboat Orthopaedic and Spine Institute comprises a dedicated local and highly trained specialists of 9 physicians bringing world-class orthopedic care to Northwest Colorado and the surrounding region. They bring an unparalleled level of fellowship-trained medical professionals with a mission to provide the optimal patient experience in surgery, treatment, recovery, and rehabilitation from head to toe.